Now we have Dr. Hitisha MITTAL. Her paper is winner of DB Chandra Disha Award, and she is going to talk on rescuing conjunctival lymphatics from mitomycin C-induced damage in rat model of glaucoma surgery.
Thank you, sir. Good morning, everyone. So one might wonder, why do these conjunctival lymphatics needed rescuing in the first place? This is because the conjunctival lymphatics are damaged during glaucoma surgery due to cutting, usage of cautery, and application of mitomycin C, which not only damages the pre-existing vessels, but also prevents their reformation in the post-operative period. A study published in 2021 used ocular surface lymphangiography to see the role of lymphatics in fluid removal from the subconjunctival blebs in live humans. Another study published in 2016 assessed the density of blood and lymphatic channels in eyes with leaking blebs post-MMC trab and compared it with the normal human conjunctiva. They found that the blood vessel and lymphatic vessel density in MMC-treated eyes was significantly reduced when compared to normal healthy conjunctiva, thus hypothesizing the toxic effect of MMC on these newly developing channels. So these damaged channels would result in a defective fluid removal from the subconjunctival space, eventually causing bleb failure. This led us to wonder, can we induce lymphangiogenesis in the subconjunctival space, especially after MMC application? So we did some further literature search and found this molecule retinoic acid, which has been studied in rat tail models of lymphedema and has been known to cause lymphangiogenesis. But we could not find any study that used these molecules on conjunctival lymphatics. So we devised this study to see the effect of MMC on conjunctival lymphatics and to see if we could reverse this MMC-induced inhibition of lymphatics by simultaneous usage of retinoic acid. It was a prospective experimental interventional study done on 25 Sprague Dawley rats who were divided into 5 groups. We used a 30-gauge needle to inflict injury in the subconjunctival space in the superior quadrant and formed a bleb. This bleb constituted BSS in group A, mitomycin C in group B, retinoic acid, which was the molecule under study, in group C, a combined MMC and retinoic acid bleb in group D, and DMSO bleb in E. DMSO is dimethyl sulfoxide. It is the vehicle used to reconstitute this retinoic acid molecule, and we wanted to rule out any confounding effect of DMSO on the lymphatics, hence this 5th group. On post-operative day 14, all eyes were enucleated. The superior conjunctival tissue was excised and sent to our pathology lab to stain with mesenterichum, CD31 and D240, which are the vascular and lymphatic endothelial markers respectively. And we looked at the fibrosis, lymphatic and vascular density. Now coming to the results, these are the D240 stained specimens from our rat eyes. The upper left image shows the normal conjunctival tissue and the arrows marked shows the pre-existing conjunctival lymphatic. In the next image, we can see there is an increase in the number of conjunctival lymphatics in BSS treated eyes. This shows that in response to a local injury, there is an increase in the number of conjunctival lymphatics. In third image, we can see that there was a reduction in conjunctival lymphatics in the MMC-treated eyes alone. And the fourth image shows an increase in number of lymphatics in the combined MMC and retinoic acid-treated eyes. This table highlights the mean lymphatic count being higher in the combined MMC retinoic acid group when compared with the MMC-treated eyes. The first graph here shows intra-group analysis. We can see that the MMC-treated eyes had a significantly lower lymphatic count when compared to a control eye which did not have any intervention done on it. And the combined MMC and retinoic acid group had a higher lymphatic count when compared to the control. In an intergroup analysis, there was a statistically significant higher lymphatic count in the combined MMC retinoic acid group when compared to the other groups. So, MMC resulted in significant reduction of conjunctival lymphatics. Retinoic acid, when used alone, caused increase in conjunctival lymphatics, and it also caused increased conjunctival lymphatics when treated in MMC-treated eyes. So we conclude that synthetic retinoic acid can prevent the MMC-induced reduction of lymphatic vessels in rat eyes. This has a potential application by preventing and reversing the MMC-induced complications which we see in our glaucoma surgery patients, and thus can improve surgical outcomes. I would like to thank my mentor, Professor Pandav, who's present here, for helping me throughout the study. Thank you very much.
Yeah, very, very good study. My only simple query is, why are we giving these two, retinoic acid and MMC, together? Because we are studying only the lymphangiogenesis, right?
Yes, sir.
Because we don't know what is the effect of this thing on fibrogenesis. If we have, maybe this retinoic acid is also inhibiting the effect of anti-fibrotic
So
action.
actually, we studied fibrosis also. Due to time shortage, I did not include it in this study. We also saw the fibrosis patterns, and there was no difference with retinoic acid on the fibrosis pattern. So it did not have any effect on the fibroblasts. We used Mason trichome stain. We had a separate fibrosis group as well in the main study, but there was no statistically significant difference in the fibrosis group with retinoic acid. We found
So
difference in the lymphatic.
it is only selectively increasing
Lymphatics,
lymphangiogenesis,
yes.
not the anti-fibrotic action
No,
of the
it does not have
MMC.
anti-fibrotic action. No, it does not have the pro-fibrotic action.
Maybe you can do a subsequent study where you compare simultaneous injection with sequential
So there is a
injection.
subsequent study going on.
Yeah,
We'll
yeah.
share the results soon. It's going
Okay,
on.
thank you.
Thank you.